So we're getting to look at the next blood vessel right here before us, which we'll be looking at its clinical importance. So clinical importance is more of like reasons why we actually study the anatomy of a particular artery. So this is the inferior ulnar collateral artery. So we're looking at its clinical importances, So inferior ulnar collateral artery, this is the artery right here. And you can see that it's around the elbow joint. It gives a lot of blood supply around the elbow. And of course, if I want to do any surgeries around the elbow joint, I should have the anatomy of this artery offered because I don't want to injure it during the procedure of the surgery. Okay. So it's a branch of the brachial artery and it arises just above the elbow and it contributes to the blood supply around the elbow. So collateral circulation, it plays a key role in the peri-elbow arterial anastomosis. So it connects with other branches. So as it is connecting with other branches, it's making it very much likely that if any other branch is affected, the blood supply is still maintained around the elbow joint, So the collateral network ensures that blood flow to the forearm and the hand is ensured even when the brachial artery is occluded or compressed, So surgical relevance is surgeons must be aware of its cause during elbow surgeries, fracture fixation, joint replacement and tendon repair. So if you preserve it very well, it will maintain the blood supply around the elbow and it will help that cases of ischemia are kept low. So imaging too, they image it in all those angiography, CT angiography, Doppler ultrasound, just to access how the blood supply around the elbow is still being maintained. So because it lies around the joint and you have a lot of bones around that place, there's a risk of this artery being injured if there's any fractures or injuries to the elbow joint. So damage can now compromise the collateral circulation that we're talking about, which is one of the importance. So if you are aware of its vulnerability, it will help you, in management of elbow issues, planning of surgeries, and the rest of it. Okay, so this is the inferior ulnar collateral artery.